So welcome everyone to the kickoff of the second year of the Virtual Learning Collaborative, made possible in partnership with the CDC's Division of Viral Hepatitis. My name is Isabel Lechuga. I use she, aya pronouns. I'm part of the hepatitis team at NASTAD, and I will be the moderator for today. Yay. In terms of what to expect for this session, so I'll get us started with a brief overview of what our proposed format for year 2 of the VLC will be. Then I will turn it over to our HepTech evaluator, Lina Cherfas, founder and consultant at A Good Question, who will provide findings from our VLC Year 1 evaluation work. Then we will focus on the technical topic for today, which is implementing hepatitis services in high impact settings, beginning with Katie Howe, who is the Prevention Program Manager with the Center for HIV, Hepatitis, STD, and TB at the Rhode Island Department of Health, Pamela Davis, Program Manager, HIV, Viral Hepatitis Counseling, Testing, and Linkage with the Bureau of Communicable Disease Prevention and Control, STD, HIV, Viral Hepatitis Division at the South Carolina Department of Health and Environmental Control, and Venetia Heron, who is the Viral Hepatitis Prevention Coordinator and the lead on the at-home HIV self-testing initiative at the Connecticut Department of Health. So feel free to use the chat to introduce yourself, pronouns if you like, your role and jurisdiction, and of course questions, which we will get to towards the end. Please know I'm not paying attention to the chat right now. All right, so what's new for the VLC? In terms of our proposed format for this upcoming year, we are planning on focusing on one topic per month. The first session of the month will be presentation based. And for the second session of the month, we will have breakout sessions to allow attendees to directly engage with presenters. We're hoping to facilitate a more intimate setting without the added pressure of a recorded session. So the presentations will be recorded and uploaded to our YouTube playlist. Special thanks to our comms team for always really quickly uploading our recordings to NASTAD's YouTube channel. The breakout sessions will not be recorded, and there will be a facilitator present for each of the breakout sessions. So on this slide, we are debuting the calendar for year 2, which will be available soon, if not already, actually, on our microsite. As I mentioned, the topic for September is implementing hepatitis services in high impact settings. And as I mentioned, today's session will be presentation based with some time at the end for Q&A, and next week's session, which will be the workshop. It'll be breakout sessions with Katie, Pamela, and Venetia that are aimed to create direct and intimate engagement. So our goal for the workshop sessions is to discuss topics such as lessons learned, what it means to navigate the bureaucratic landscape, and hopefully candid conversations about what hasn't worked and where there's room for improvement. So additionally, we are accepting both presenters and facilitators for year 2. So the submission form will be available via the chat and via our microsite as well. Also of note, we will be doing outreach in the next few weeks to jurisdictions that we have not connected with directly this past inaugural year of the VLC to learn more about your programming, your activities, and your work, and to hopefully have you present said work during the VLC. Volunteering as a facilitator also allows for folks to use that time to ask questions that would be helpful for their own jurisdiction. So feel free to use that time for your benefit. Before I turn it over to Lina, I want to thank my colleague, Zakia Grubbs, who's a manager on the hepatitis team, for her leadership and work on the second year of VLC, and to the HepTech Advisory Committee, specifically Amelia Salmonson, Danica Kuncio, and Heather Bush for their contributions. So with that, all right, with that, I'll turn it over to Lina, the incomparable Lina.
Thanks, Isabel. Hi, everyone. My name is Lina. I use she, her pronouns, and my consulting practice is called A Good Question. I've been fortunate to work with the HepTech team for a couple of years now to assess the various TA, and offerings such as the VLC. So today I've been asked to present back to you all some findings from the first year of the VLC and discuss how what we learned from you all, from the participants of the VLC last year, is informing the next steps of the initiative. Next slide, please. So overall, these are our evaluation questions that are rooted in the Kirkpatrick model of training evaluation. So everything we're discussing is kind of rooted in these three levels of the very basic one of do people like the VLC? How satisfied are folks with the sessions? The next one is learning, or are the sessions providing opportunities for sharing new information at each session? And then lastly, to what extent participants feel comfortable applying what they learned. So this is kind of the golden egg here, right? We all have had experiences of attending things that where we learn something new, but we're not really sure how to integrate it into our work. So those are the main questions that we have been asking throughout the first year of the VLC, and will continue to ask moving forward. And we also looked at how all of these things differ or don't differ by the type of sessions that we had last year and the length of experience of the survey respondents in the viral hepatitis field. So last year, next slide, please. So last year we, because it was the first year of the VLC, we asked folks to complete very, very brief post-session surveys after each session, just so that we can see, kind of the progression of the data over the course of the year, and make sure that, any troubleshooting that needed to happen happened. This year, because it's the second year, we will be doing just 2 surveys, one at the midpoint and one at the end. And then we also ran a couple of focus groups last winter, just to get some more rich, feedback from the participants of the VLC. So next slide, please. And of course, we looked at attendance, which was very high throughout the year. I was really pleased to see that it remained high even into the summer sessions. So that was an indicator right there that folks were interested in what the VLC had to offer. Next slide. We also tracked the presenters over the course of the year to see where they were coming from in terms of the country, and it looks like West Coast and Alaska and Hawaii, region E was kind of killing it with the presentations, 14 presentations from that region, but a healthy amount from many other regions as well. Next slide. So these are the all of the sessions throughout the year, kind of charted along the continuum of overall satisfaction and this thing called Net Promoter Score, which is essentially whether folks would recommend these sessions. And we saw that satisfaction remained really high throughout the presentations. Next slide, please. And like I said before, we got some richer feedback, some qualitative feedback in a couple of focus groups in last winter, and heard a little bit about what exactly folks meant by like that confirming that they learned a lot from the VLC. So this top quote is from a person who's saying that they've kind of like heard of all the topics, but even still, they learn something new from each one, or each product or tool or something that they could look into. So even topics that they've learned about before, that they implement work around, they found new information imparted in the VLC sessions. And this other person as well is saying, elimination planning, of course, is high on everyone's radar, high top of mind for a lot of folks, and they were saying that elimination planning related content was really useful for them. Next slide. And then we also saw, this yellow line is for, whether people agreed that the sessions were relevant and applicable. The gray line is for whether they learned something new, and the teal line is whether they feel prepared to apply the learning. And as expected, that teal line was a little bit lower in terms of the percent agreement than the other lines, because it's always, it's always harder to actually take home and apply something new, some new content. Top areas for improvement suggested by survey respondents were kind of, had a theme to it, like, please, more engagement, more time for the presentations, rather, more time for questions. And that was really echoed in the focus groups as well. So next slide, please. Where in terms of, how do we, in response to the question of how to make the learning more applicable and how to help folks apply what they're hearing in the VLC, they suggested, breakout sessions, case conferencing discussions, small groups, like basically more interactive sessions, fewer presentations per session, and also more on the nitty-gritty details that will actually help them apply the learnings. So that is a big reason why, that all of that feedback put together is a big reason why the VLC has shifted to its current format for this year of offering a session and then, a presentation-based session, and then a breakout kind of discussion-based workshop session in the later part of the month. So yeah, we are, what I'm saying basically is we take this feedback very seriously, and we talk about it. We have meetings every month, and we actually, apply the learning from the evaluation. Next slide, please. And all the way to the next one. So taken together, although we had a fairly low response rate on these surveys, we know that asking folks to fill out even a very short survey is kind of a lot sometimes. But we take the feedback very seriously nonetheless. So we looked at all of these ratings across the sessions, and they were, of course, overwhelmingly positive. And the top area for improvement was participant engagement. Next slide. We also looked at all of these ratings in terms of the type of session that they pertain to. So there were surveillance sessions, prevention sessions, and joint sessions. And we found no differences. So that means that regardless of the type of session, as well as regardless of the respondents' level of experience in the field, these ratings remained, very consistent. So that was again very encouraging and very reinforcing of the direction of the VLC as well. Next slide. And over the summer, we asked presenters, VLC presenters, for their feedback of their experiences so that we could learn from them as well. Next slide. We heard from 16 of the 40 or so, I believe, presenters that they were, satisfied with their experience presenting, and almost all of them said that they would agree to present if invited. Next slide. And they gave us feedback about the extent of preparation and the quality of preparation they had prior to their sessions. So we, pretty good feedback there. They felt prepared. They felt like that they were given the right amount of guidance, that they were reached out to in time to prepare and things like that. And then finally, next slide. We also asked them about their experiences during the session, and we saw that they enjoyed sharing with the audiences. The sessions went pretty much as expected, but they were less likely to say, for example, had less positive feedback about the moderation of the participant engagement and the questions. So that really resonates with the feedback from participants in terms of, the top area for improvement was more participant engagement. So that really resonates and kind of is consistent along those same lines. So I don't know if we have time for questions now, or we save them till the end, or if there's some in chat. I definitely have not been looking at the chat, but I'm happy to answer some questions.